My name is Amber and I'm a communications staff with AOM. We're here from the AOM conference and I'm joined with Dr. Eileen Hutton, a midwifery researcher who gave our keynote today. And we're doing a Periscope video, and I was just hoping, Dr. Hutton, that for those who couldn't attend, maybe you could give us just a really quick summary of what you touched on today.
Wow, that's a big job. I think the key kind of message is, well, the theme of the conference, as you know, is excellent care for all. And I think the key message was that research really informs what excellent care is. So we looked at a few examples of care that might have existed 50 years ago and why the care at that time was maybe not what we would consider excellent care now, and how much of what's crept into care, or standard of practice, has not been well established using research, and to the detriment, I think, of the care we provide.
Great. And you talked a little bit about not just collecting data, but using that to change practice. And I thought, could you give a little bit, or an example perhaps, or touch on the importance of sort of using that research that we collect?
Yes. Well, I think an excellent example that I presented in the talk was to look at the data that's been collected in Ontario by midwives in Ontario through initially the Ontario Midwifery Program and now through BORN, and looking at the outcomes for planned home compared to planned hospital birth. And so in the presentation I compared the findings from the study that we recently published in December of 2015 in the Canadian Medical Association Journal with the study in the New England Journal that reported on the study in Oregon. Quite different conclusions from those studies. The Oregon study showing that out-of-hospital birth was associated with a more than twofold increase in the rate of neonatal and perinatal mortality, and the Ontario data showing that in fact with home births compared to hospital births, planned home and planned hospital births in Ontario, the outcomes were equally excellent. So I think that the importance of us not only collecting data but also analyzing it and understanding what it's telling us about the care we're providing is essential.
Great. And I think lastly you touched on a little bit in your other answers, but sort of the key takeaway for midwives who couldn't be here today, the key takeaway you want midwives to keep in mind when it comes to research or midwifery research.
Well, I think just the key takeaway is that research is done by researchers but needs to be supported by midwives as individual practitioners. It needs to be supported by the association, by the colleges, and by the funding organizations in order for us to be undertaking the very important research that we have to do. So it needs to be a joint effort, and we all need to recognize the role it has to play in terms of providing excellence for all.
Great. Thank you so much.